Thank you so much, Dr. Shuba Iyengar, for coming on Wellness Your Way. I'm excited to have you here today.
Oh, thank you for having me, Megan. I'm excited to be here. Absolutely.
Of course. Well, I've read your very impressive bio to the audience, but I'd love to just hear in your words a little bit about you.
Oh, yeah, absolutely. So I am an allergist. I work in Northern California. I've been doing this for a while now, so probably about 15 years. As we talked about, I trained in Boston. I was a fellow there, which is like sort of the specialty training for allergy. And then I was at Mass General for a couple years, and then I moved out to the Bay Area about, oh my gosh, it's almost been about 10 years now. Yeah, and it's been great here. I work at a private practice. I work with Dr. Robert Bocian, who is also a, a co-founder and scientific advisor for Allermi, which we'll talk about in a little bit, which is a company where we make customized nasal sprays for for people to help them with their symptoms. And yeah, I have twin boys. They're great. They used to be much more crazy, but they're less crazy now. But yeah, it's been great.
Oh, that's incredible. So your hands are full. You're doing a lot, but so much great work. And I'm excited to dive into some of that. Let's just start
Absolutely.
though. Yes, let's start very high level. For people
Sure.
who don't even know what's happening, aside from, oh my goodness, my nose is itching and I feel snotty and coughy and bad, what
Mhm.
even are allergies? What's going on in the body?
It's such a good question, right? Because sometimes people think about allergies and they're like, oh, my immune system is low, like it's not able to fight infections, like that's why this is happening. And no, it's kind of the opposite. Allergies happen because your immune system is just like it's going crazy. It's basically responding to or kind of attacking things that it's not supposed to attack. So you're responding to like your immune system is getting fired up because of pollens that are in the air, or maybe because in some cases because of certain foods that you're eating, and it's attacking things that it's not supposed to attack. And when that happens, lots of things happen. Like people feel allergies differently, but a lot of times if it's a pollen allergy, the allergy cells will like give out chemicals that cause you to feel itchy. So you get like itchy eyes, itchy nose, runny nose, or you get congestion. So your nose gets really stuffy, or you feel like there's stuff coming out of it. Or sometimes if it gets really bad, things, you can get headaches. What we see a lot with environmental allergies is that it starts in the nose and your nose is swollen, but you can't tell because you can get by, right? Like if you can't breathe through one side, you'll breathe through the other. And if you can't breathe through the other side, you'll start to mouth breathe. But when that nose gets pretty swollen, all that mucus that wants to come out can't. So it starts to go backwards on the back of your throat. You end up with that cough, or it goes into your sinuses and you get that sinus pain and pressure. And so by keeping this better, you can prevent all of that from happening.
Incredible. And so now some of the astute listeners are thinking about inflammation, which is a topic that we talk a lot about
Yes.
here. How is inflammation connected to allergies?
So when your body starts to go like crazy, right, and starts to respond to things that's not supposed to, it it starts to call out all these different cells in your body that trigger inflammation. Like it calls out all these different cells that usually fight infection, but now they're coming to the places where it's trying to attack the pollen or attack the food. And so you get the swelling, you get the redness, you get like the itchiness, you get the congestion. Um, and the thing about inflammation, which you probably know because you're an expert at this, especially with nutrition, is that inflammation snowballs, right? So when you're already inflamed, it doesn't take much to get even more inflamed or even more inflamed. And so that's when you start on this crazy cycle of now everything is making you more and more inflamed. And inflammation can feed from different things. Like for you, like a lot of it's nutrition, right? It's what you eat. But for us, for allergy, a lot of it's like the pollen or the food, and it's a different kind of immune system reaction. But it all kind of heads into the same point. Like different things are causing you to be inflamed overall. And now because you're already inflamed, every little thing is making it worse. And so it's this big snowballing effect. And if you can prevent the inflammation at the very, very start, you can prevent that snowballing effect from happening.
I love that. I always get delight when my clients are working on reducing inflammatory food intake. And then all of a sudden they say, oh, wow, my allergy, my seasonal allergy symptoms are slightly reduced. Could that even be a thing? I'm like, yes, maybe food is not enough. And thankfully, we have treatments out there, which we'll talk about with you. Maybe it's not enough to totally take care of it, but it's not surprising to me at all that as we reduce the inflammatory load of our diet, some of these other symptoms might get a little better.
Absolutely. Clinically, like I can't like speak to the different studies that are out there that look into this because I don't think there's a lot of research in it, unfortunately. But I can say that in my patient population, I see this all the time. And especially it's those patients who have double triggers, like they have both allergy and then they have autoimmune issues because there are two different arms of the immune system. And when they have that, I see that these people are really, really, this population especially, are really, really susceptible to inflammatory triggers. And so going down on inflammatory foods in the diet for a lot of people really, really helps them. And so it's definitely anecdotal and it's definitely more clinical, but I have seen that absolutely.
Amazing. I keep hearing every single year, oh, allergies are really bad this year. And it seems like everything is steamrolling. It's just getting worse and worse and worse. Is this true, or are we just talking about it more? What's going on here?
No, I think it's true, and there are definitely studies that have shown that, and everyone always asks me like, "Dr. Iyengar, like, what's going on? Like, why is this happening? I don't have allergies in my family." Or oftentimes I see people who come in they're much older, right? They're in their 70s, they're in their 80s, they're like, "I got through my whole life and I never had allergies, and now all of a sudden I'm having bad allergies." So we see it a lot. And there are many different things that probably contribute to it. And Megan, you can definitely speak to like the fact that inflammatory foods probably play into this, like glass kind of half full thing. The way I think about it is that you have a glass that's full of protection, right? That protects you against getting like inflammation or allergies. But there are things that take away from that, right? Like if maybe inflammation in your diet, maybe if you're sick with a cough or cold, you pour some of that out. If you have pollen allergies or if you have other allergies, you pour some of that out. If you have, sometimes people, if they have sensitive skin, because you can get sensitized to the skin, you pour some of that out. So somehow that glass gets half full. And in order to fill it back up again, you have to address each and everything that could be triggering the inflammation. And you have to fill it back up again to fill back your protection. And so part of that thing that's contributing to the glass being half full is probably also climate, right? With climate change, we have seen much longer pollen seasons all across the country. And we've also seen much higher pollen counts. And also, it's just erratic, right? Like all of a sudden, like there's flooding in one place, there's huge fires in another. Like, what is going on? Earthquakes in places we've never had earthquakes before. It's shaking up our earth, but it's also shaking us up, right? We're not used to these dramatic changes in temperature or climate. And so that's also probably contributing to the allergies that we're seeing.
That's a great point that I've actually never thought of. Dallas, where I am, and we have a big listener base from Texas, we have very dramatic shifts. It could literally be in the 20s one day and in the 70s 2 days later. So that's great to make that connection between allergies and those shifts. Thank you for that.
Yeah, I don't know if it's been well studied, but I do feel like I've seen it a lot, especially here in the Bay Area, unfortunately, right? We've had so many dramatic shifts in climate, and I've seen like patients come in and all of a sudden their allergies are bad, just with that change in season or that shift. And so although it's a lot of it's anecdotal, I do see it.
Yes. Well, you are an expert in treatments. So let's just start unpacking some of these types of treatments that are out there. And maybe
Yeah.
could you walk us through some of the benefits and the trade-offs of the most common types?
Yeah, absolutely. So we can first talk about pollen allergies because that's, what we've been focusing on. So as I talked about, like when you get bad pollen allergies, like what happens, right? Your nose gets a little bit swollen, but you can't tell, right? Because you get by. Like if you can't breathe through one side, you'll breathe through the other. If you can't breathe through the other side, you'll mouth breathe. And when you mouth breathe, oftentimes like you snore. And so a lot of people have problems sleeping at night, right? Because they're snoring because they can't breathe through their nose. And so it really affects the quality of their sleep or all that mucus that wants to come out can't, so it goes into their sinuses, and all of a sudden, they get sinus pain and pressure, they get headaches. Or what I see the most often actually is that postnasal drip. It goes on the back of their throat, they get that tickle or cough. And they're like, I can't go through a meeting because I keep coughing, or they can't sing. A lot of people, I see, are singers. And so not being able to use their voice is a big problem. We see it a lot in our Allermi reviews too. Like it really makes a difference. So getting that nose better is key, because
Yeah.
once you bring down that inflammation, all of that stuff goes away. And so a lot of times as allergists, even without customized nasal sprays that we have at Allermi, we'll tell people like, we want to bring the inflammation down in your nose. And to do that, the best medicine is always going to be a nasal spray. The allergy medicines by mouth that you get at, like, I don't know, the drugstore, like Target or Walmart, like they will make they will make you feel less itchy, like the Zyrtec, the Claritin, all that stuff, but they don't make this that much better. And so to get this better, you need nasal sprays. And there are different ones out there, right? The most common you've probably seen on the shelf, like Flonase, Nasacort. These are what they call anti-inflammatory sprays, right? They're basically very diluted nasal steroids. I don't want most people to worry about the steroid part. For the most part, a day of a steroid by mouth is equal to months of the spray. It's so diluted. But
Okay.
because it is so diluted, if you use it by itself, it takes a long time for it to have an effect. So we almost always add on other sprays. So we often add on something called Astelin or azolastine. It's an antihistamine spray. It works well. If you don't use the spray properly, it tastes like yuck. So you have to use the spray properly. But when you combine the two sprays together, you combine more than one spray together, they work well because they complement each other. Like one works really fast, one works really slow. And so using them together is key. So I'll often have people line the little bottles up by their toothbrush and use one after the other in a row, which is kind of hard to do, right? You have to like keep track of everything. Sometimes we don't have big counters. And so at Allermi, what we do is we basically combine these different sprays into one spray, depending on how people are doing, depending on their symptoms. And we can, because we can compound, we can control the amount of each ingredient that we use. And so we have all these algorithms that we've developed, depending on how people are doing, to be able to really personalize or custom that spray towards what we think would work best for them.
Very interesting. So am I understanding it correctly that something like Flonase, that's one type of anti-inflammatory, and the other, the azolastine, was a same anti-inflammatory, just longer or shorter acting, and so you're combining them?
No, almost.
Okay,
So
tell me.
the anti-inflammatory is yeah, like Flonase is kind of the not so greatest of all the sprays because it has
Okay.
alcohol in it. So we
Oh,
usually use triamcinolone or Nasacort, which doesn't have the alcohol in it, which is nice. Not for our own. We use the generics for our own, but like in general, like
right.
just know that not all sprays are equal. But yeah, that's a anti-inflammatory, and that works well, but it lasts a long time. But when you use it, you don't feel it right away. Like you don't feel like
Right.
anything's happening. So people will go to the drugstore and use Flonase or Nasacort, and they'll be like, I used it, but I can't tell if it helped me or not because
Right.
nothing happens right away. With the azolastine, it's an antihistamine spray. It's kind of like Zyrtec or Claritin, but it's just for the nose. And it
Got it.
works well and you feel it right away, but it only lasts like 2 or 3 hours. And then
Okay.
after the 2 or 3 hours, it's kind of gone. And so using both together are really helpful because they complement each other. One works very fast, like you said, and then the other works very slow. And so combining them together is helpful because they really help with the symptoms that people are having. And so that's sort of the basis of what we do when we compound these ingredients together into one spray. We use different ingredients that complement each other and work in different ways to get people better.
Amazing. And so if someone were to come to you at Allermi, which I believe is telehealth, they're available, you can serve clients all over, patients all over. What kinds of information would they give you in order for you to customize this spray for them?
Yeah, so it's like seeing like one of us, right? It's like seeing an allergist or a doctor at the office, but we do it online. So you fill out a questionnaire that talks about like, oh my gosh, like what kind of symptoms are you having? How long have you been having it for? What has helped you in the past? What have you used? What has worked? What hasn't worked? When do you have symptoms? What do you think trigger your symptoms? Even if you haven't had testing, it's okay. We can still treat people really, really well, even if they haven't had any testing done. And then when they give us all this information, we have a doctor review everything. And after they review it, they have a customized care plan. So we send out a plan that's just for them, that tells them, okay, this is what we're going to do, and we're going to send you, we're going to basically compound or mix up a spray just for you that we're going to, through our compounding pharmacy, that's going to be delivered to you, so you can try that as well. So everything gets delivered, and then and you're in constant communication with the doctor through messaging. And so you can message them, they can message you, and then on top of that, we have a care plan that goes through everything. The key with nasal sprays that no one ever realizes is that you have to use them properly. No one knows this because no one tells you, right? But if you don't use the nasal spray properly, that's when you get issues. So when you use sprays, you always have to kind of stand up like this and then look down at your feet, nose to toes. That creates the perfect angle. Perfect, you got it. And then you put the tip of the spray in your nose, but you
Okay.
point it towards your ears, away from the middle
Oh,
of the nose. Yeah. The middle of the nose is really sensitive. You don't want to poke it. That's why you're pointing it away. And then spray with the, you sometimes, if we have more than one bottle, we say spray with the first one, and then spray with the second one, or spray with the third one. But luckily with Allermi, we just have one bottle, which is great.
yes.
The other key is they always have to lean forward. Never lean back. If you lean back, it'll go on the back of your throat. You'll hate it. And so it's really important to do these things, and people don't realize it. And then when they use the spray, they're like, oh, I tried it, but like I tasted it, or it made me feel weird. And if they just, if someone had just told them to use it properly, it probably would have like eliminated all of those side effects.
Well, I have to say, I have used nasal spray. I don't have terrible allergies, but I've definitely used it in the past. And I have never known that. I did taste it, absolutely. And it did not taste good. And I wish someone had told me before. So I'm so glad that I'm learning right now. This is fantastic.
They
Now,
always say like if you taste it, you waste it, right? So that's some like one of those little mnemonics or whatever. So like always remember, like lean forward, because otherwise you waste it. But then you taste it too and you're like, ah, I don't like this stuff.
yes, it's certainly not pleasant. So thank you. I now, my life has changed. I do have a couple more questions though
Yes.
about you customizing this formula.
Yes.
So it is not like sublingual immuno or any kind of immunotherapy. You're not putting people's allergens in there. You're just customizing the treatment. Is this true?
Absolutely. It's such a good thing because sublingual immunotherapy is different, right? Sublingual immunotherapy works well if you have like one or two allergies. If especially like for people who have like cedar fever. I hear in Texas it's really popular because there's only
Yeah.
like one or two things that really cause symptoms certain times of the year. And so they bake these little drops that you can like put under your tongue, and that while you're taking them, they help with your allergy. It's kind of like a step above like local honey,
Okay.
right? When you stop using it, your symptoms, come back again. But when you're using it, it sometimes kind of like decreases the symptoms.
Okay.
The problem is that for most people now, maybe back in the day, like most people are allergic to like one or two things, and it was really helpful. And for some people, yes, I should say that it is helpful. But for a lot of us, we are allergic to many things, and
Yes.
the drops just don't work as well, right?
Got
And to
it.
get like the really powerful drops, like which is the FDA approved ones, you have to go through your doctor, and they don't let you start at home. You have to take it in the office because we prescribe like EpiPens and things like that because we're making it strong. So when you get it, sometimes, because they do have companies that do this online, and I haven't tried it myself, but I can say that like if you're not doing the first thing in the doctor's office, how strong is it really, right? And if they're not carrying an EpiPen with them, because normally we do that, right? For when you get it in the doctor's office, you have an EpiPen. How strong is it? And so I don't know for sure, but I can't imagine they can make it as strong as they would, when people get it at the doctor's office.
Yes.
What is helpful about nasal sprays is that when you're allergic to multiple things, right, it causes that nose to be swollen. And so when you use the spray, you feel better almost right away, right? You don't have to wait days for it to take an effect. You don't have to worry about it not being strong enough, because we can customize the formula depending on how you're doing. And so for that immediate relief where you're like, I need something to help me now, it's super helpful because it works very quickly.
Got it. So then you asking people, like, what do you think you're allergic to and how many? What are your triggers? That's really more to decide, should we lean into the histamine response, or does this person have tons of allergies, so they need higher treatment. You're customizing the types of treatment. You're not customizing based on specifically what they're allergic to. I know I'm not exactly saying that, but do you understand
Yes,
where I'm
we're
going? And do you have any
no,
comments?
no, you got it. Yeah, you're an expert now. No, exactly, you got it. So debate depending on like how swollen we think it is up here, if they have sinus symptoms, do they have sleep symptoms, right? What kind are they getting itchy? Are they getting congested? Is their nose dripping? We can use all of that information to figure out what ingredients to put in their formula and kind of what how much of each to put in, like what the ratio should be.
Great.
Then granted, everyone is different, right? Oh yeah, I was just gonna say, like when you go to the drugstore, like, you're buying what everyone else is buying, right? You're buying like whatever, Zyrtec, Claritin, Flonase, and you're using it all together. And maybe sometimes it works and maybe sometimes it doesn't. But everyone's different, right? Everyone's symptoms are different. And so when we do the sprays at Allermi, we are using what you're telling us. Like, are you congested? Do you have postnasal drip? Are you itchy? Do you get sinus symptoms? Are you having problems sleeping? All of that goes into what ingredients we put into your formula and how much of each thing we put in. And so, using that, we make a starter formula for you. So we're trying to like optimize, like, okay, what do we think would work well? But no one's perfect and everyone's symptoms change. So after like a month, if you feel like, oh, it helped, great, we can do that again. But like maybe after 2 months, that doesn't work as well anymore because your symptoms are now worse because it's like cedar fever, right? Or something else is happening. And so we change the formula again, depending on what you tell us. So that's the thing. We're trying to adapt with you because we know that your body changes, your allergies change. And so by kind of getting good assessments every so often, we're able to change that formula to make it work better for you.
Amazing. That sounds fantastic. And I'm uplifted by that comment. I think we're all going to be taking a little bummer for this next one, but I'll give it a shot anyway. Is
Yeah.
there a cure, a lifelong cure for
Oh,
allergies?
oh, such a good question. And I can say, like, I am a bad allergy sufferer. I have horrible environmental allergies, right? I am on Allermi myself. Actually, almost all of us who work at Allermi, we're all on it because we have bad allergies. We suffer
Yes, you
ourselves.
feel the pain.
Yeah, yeah. And so it depends, right? Some people, they do well on sprays. Sometimes they take oral antihistamines as needed, which I don't love. I don't love oral antihistamines because they go everywhere in the body, right? So they're systemically absorbed. They're not just going to the nose, and they make you feel less itchy, but they don't always treat the root problem, which is the nose. But some people do use them. A lot of people do allergy shots. So allergy shots are when we mix up everything you're allergic to, and you get small amounts of it, but it's commitment, right? It's often once a week for 6 months to build up to a top dose. And then it's once a month after that for about 2 to 5 years, depending on how you're doing. For people like me, it's like 10 plus years because I have horrible allergies. But over time, some people, most people do really, really well depending on what their allergies are and what their testing shows, because we're using testing to kind of gauge probability that allergy shots would be helpful. But yeah, usually most people, like after, a year, I'm able to cut meds in half for a lot of people. And after like 3 to 5 years or 5 plus years, they're done. Like they have good long-term effect of their shots. The key, like the best are the kids. The kids are awesome because their immune systems are so flexible, right? They're able to get better faster. So they often get better in half the amount of time. They get better in like 6 to 8 months. And they only need shots for like maybe 5 years. So I started my kids on shots really early, actually. I started them at 7 because studies show that if you can start kids early enough on shots, you can sometimes prevent the onset of allergic asthma. And so there are definitely good long-term options for people who have allergies. With allergy shots, no, it takes like for a lot of us a good year for it to kick in. And so doing nasal sprays is often helpful, especially in the beginning, because we're giving you what you're allergic to, plus it's in the air. Sometimes it's a double whammy. And so you need something to protect yourself, especially while the shots are taking their time to kick in. So that is
That's
an option for a lot of people.
That's very insightful. I will say I never really had allergies as a kid, never had allergies in Boston, New York, Miami, and then I moved to Chicago and my allergies were just crazy. And I did allergy shots up there and it very
Oh,
much
good.
helped. And I feel like I needed to stop doing them when I moved back to Dallas. I must just not be allergic to Dallas, and I was allergic to Chicago, but that was a treatment for me. Now I use nasal spray, which, as I said, I have tasted, and now I'm going to highly consider switching over to Allermi because it sounds like you have exactly the combination that is suited for people. So I'm very excited about what you're doing.
You should definitely try it. I really feel like it might help you. And then let us know how you do. Like, after like a couple weeks, if you feel like, it's not working as well. I mean, a lot of people do really well actually on their starter formulas, but if you feel like after a couple weeks you need something different, let us know because we can always tailor it or switch it for you. I'd love to hear what you think.
Yes, that's so exciting. Thank you. So let's talk about nutrition, my favorite subject, and
Yes,
lifestyle and all kinds of things tangential, which we can do in support of our bodies in addition to taking nasal sprays.
absolutely.
What are some of your favorite things to recommend for people to support a healthy immune response and not this hyper allergy immune response?
A lot of it is anecdotal and it's my own personal experience and, kind of what I've read. And you're definitely the expert at this, but we just talked about inflammation, right?
Yep.
Inflammation is like this big glass, right? And, there are things, or let's say we have protection against inflammation. That's a big glass. And things take away from that. Like if you're sick with a cough or cold, if you have bad allergies, if your nutrition is not optimal and you have like a lot of inflammation from the things that you eat, all of that will bring your glass half full. And so filling it back up again is helpful. And so as we talked about, like a lot of my patients, especially when they're really susceptible to inflammatory triggers, let's say they have allergies or they have autoimmune issues or they have both, right? Because these are different arms of the immune system, autoimmune on one side and allergy on another. And when both arms are lit up, you're just much more susceptible to getting inflamed. And so thinking about reducing inflammation in the diet, I think is key. And you probably know this already. I mean, a lot of it's stuff that we, maybe hasn't been scientifically proven, but a lot of what we know with the way our foods are made, right? Things that are mass produced, especially gluten, because they've genetically modified it to grow all year round. It's highly pro-inflammatory. So sometimes reducing, gluten in the diet has been really helpful for a lot of people. Same with the dairy. I never know, and you can tell me, like, I would love to learn from you. Like, is it the feeds from the cows or is it the hormones? Like, what it is about? What is it about the dairy in the U.S. that makes it so pro-inflammatory for a lot of people? I can say myself, I'm gluten and dairy free, and I feel so much better on a gluten and dairy free diet. I have even a more complicated diet. I'm actually low FODMAP too.
Wow.
Yeah, so I cook a lot of my own food. So I get it. Like when people tell me they're like, I don't know if I can do this. Like, what can I, is it possible? And I'm like, well, I've done it, but it took a while. Like I just picked one thing a week that I knew had like gluten or dairy in it or was highly pro-inflammatory. And I just tried to go through different substitutes, right? Because you know this, right? It's hard to find the right thing. Like when I tried to substitute out dairy, like I did coconut milk and I was getting such bad reflux. Like I felt so much worse. And so then I had to go to like almond milk, and then I went to oat milk, and then I love the barista oat milk; it's my favorite. But you have to find that substitute that works well in order to find like a way to sustain the diet. But I would love to hear more about like what your thoughts are too.
Yeah, I think in our perfect world where we all had healthy guts and no stress and all of this kind of stuff, I think we all would be able to eat gluten and dairy and even some processed food and whatever. The problem is that our cup has been drained in your analogy. We have so little protection from inflammation. And so something like gluten, which activates something called zonulin in your gut and can cause intestinal
Yep.
permeability, and that increases inflammation. It's just kind of piling on. It's like hit after hit after hit to our immune system. And people like me too, I'm certainly not perfect at anything, but we have stress. We don't always treat our bodies perfectly. We breathe in pollution, whatever. Gluten's just one more hit. So like you, for me, it's just a gift to my body to not eat gluten because I feel so much better that way. And I
Yep.
know that it's a big dump in my immune system or my inflammatory bucket. So I choose not to do that. I think dairy is somewhat similar, although I find people have mixed tolerance to dairy, meaning if it is really good quality hard cheese like Parmesan or something like that, many people are totally fine with a little bit of that. And then on the opposite end of the spectrum, it's like American cheese in a package that has all these hormones, antibiotics, you know what in there, and preservatives, etc. That's very mucus forming to people.
Hmm.
So
Yep.
I think many people are, so everyone somewhere on the spectrum. Some people tolerate dairy very well. Many people are okay with a little bit of good quality grass-fed yogurt and some Parmesan, and some people do better without it altogether. That one, I think, just takes a little bit of experimentation.
Yeah, no, those are really great like points and like helpful like tips for people for sure. Sometimes I tell people, I don't know if this is the right thing, so I'd love to hear what you say. I tell people to try to get it like sourced outside of the US. So sometimes I
Yes.
tell people like, oh, if you want to get your pastas, try to get them from Italy, or to get your cheeses, get them from Europe. What do you think about that?
Absolutely true. I think it's really sad, is what I think about that, but it's true. And this is all about our food system and regulations that don't apply here. So, for example, glyphosate is the, I think, appropriately demonized ingredient that we spray all over our wheat. And that exacerbates the intestinal permeability caused by gluten. Now, in Europe, they don't use glyphosate on their wheat. So even though the gluten is still in there, it's a very different reaction in our body. That's just what we spray on it. But then also the genetic modification that we have done to wheat today, the protein structures, I believe, are 80, 90, some really high percentage, completely different than what they were even
Yep.
in the
Mhm.
1960s. So it's like our body just hasn't had a chance to catch up with this rapidly genetically modified crop, and it treats it like a foreign invader, versus in Europe they're using more of the ancient style grains, which our
Mhm.
bodies have been accustomed to. So I completely agree. I think if we could all source all of our food from
Yeah.
Europe or someplace out of the US, it would be great. I'm not sure that's accessible to most people, but
I know. It's so expensive. Like,
it
you have to
is.
go to these
Yeah.
high-end grocery stores and
Yes, it
yeah, like
really is.
Like Whole
But I,
Foods or yeah,
yeah,
it's tough.
it is tough, but I do believe that just us talking about it and bringing light to it, we are creating a revolution. And when consumers
Mhm.
demand this food without
Yes.
glyphosate, for
Yep.
example, or maybe in the future, dairy without antibiotics and hormones, something like that, it will change. It just takes a little time.
I know, and it's good that it's an effort, right? And it's an effort where we all have to kind of get together and do it. And I think it's so important. I completely agree.
Incredible. Well, let's jump off to maybe some common things that make allergies worse that we're not thinking about. I have a few in my mind that I'm just so curious about what you are going to say. What are things we do
Sure.
that make allergies worse?
Okay, so the number one thing, especially for pollen allergies, that people do that makes it worse is to keep the window open in the bedroom. Like, nature
Oh,
is not your friend, right? I mean, we can have ways for you to go out and
yes.
enjoy nature, but at the very core, nature is not your friend right now. And so, if you open that window, all that pollen will come in. It will get all over your bed. It will cause you more symptoms. We have to give you more medicine, which we don't want to do. Sometimes just shutting the bedroom window, we can cut meds in half, which is huge. Yes, showers
Interesting.
at night are really good too to keep the pollens off. Shoes at the doorway so you don't track the pollens in, but the number one thing is that bedroom window, like a very common thing that you don't think about.
Okay, I did not think about that. I was thinking about shoes at the door. I thought that's what you were going to say. And then I thought of my two dogs. What in the world do people with pets do? Like, they don't wear shoes when they go outside. Do we wash off their feet or their body? What are
Yeah,
we supposed to do?
I know it's hard, right? You just do the best you can, right? We're all just doing the best we can. The good news is that even if you're cat or dog allergic, I find that most people tolerate their own pets. It takes like a good like 8 to 12 months, but most people do okay. And there are things you can do like putting an air purifier in the bedroom. If it's possible from the get-go to keep your like cat or dog out of the bedroom, it is helpful if it's possible. So I find that most people aren't they're okay with their own pets, but you're right. They go and your dog goes outside, rolls in the grass, comes back in, like what you do. Yeah, if you can just keep the bedroom a safe haven, I think that's really helpful. Like, you can't control everything, you can't control the whole house, but if you can control the bedroom, it really helps, especially the bed, because you sleep on it. Think about it,
Yeah.
hours and hours, hopefully a good 8 hours a day, but
Yes,
but it's a good number, it's a good amount of time.
that's incredible. Is it true that I've heard kids who grow up with pets in the household have fewer allergies, or is that a
Yeah.
myth?
No, there are studies that have shown that kids who grow up with pets in their household, do have fewer allergies. I wonder if it's going to change now because we have so many different factors now that are contributing to allergies. Like we talked about, like climate change, pollution, right? That definitely kind of changes the allergen structure in the air and makes it sometimes people more sensitized to it. And then, no, again, there haven't been that many studies showing, but increase other things that increase inflammation in the diet, right? Would make you as an individual more inflamed, and more inflamed people are more susceptible to getting more inflamed, right? It's that snowballing effect. So I'm really curious to see how things kind of evolve over the next several years.
Yes, I am too. This is such an exciting field, and I am grateful to you for your pioneering work in the field. It's really fantastic. If you could just leave the audience with one more thought, I'd love to hear one more tip from you. And then also, please tell us how we can become a patient of Allermi or where we can learn more.
Yeah, absolutely. So definitely like think about it like as we talked about, Megan, as a whole, right? Your body is, you want to try to keep the inflammation down as much as possible. And that might not mean, one thing. It may mean many different things. It may mean your diet, right? It may mean exercise, less processed foods, if possible. Keeping the allergy, inflammation down, keeping your bedroom window closed. All of this kind of plays into keeping building up your protection. So if one thing maybe we could talk about is like all these different things play into it. So every little thing counts, even if you think it's little, it really is helpful. And then with Allermi, yeah, definitely check us out. It's www.allermi.com, and it's spelled weird. It's spelled Allermi. And it's so funny because my kids always say, "Oh, it's Allermi," and I'm like, "No, no, no, it's Allermi." But I'm like, it does
Allermi
look like
doesn't sound as
Allermi.
great. Yes, I like Allermi, and we will
Allermi.
absolutely include the link in the show notes. It's not that hard though. Allermi, Allermi. That's a great name.
Yeah, come check us out. I hope we can help everyone. We really want to make healthcare more accessible. It's something we didn't get to talk about, but it's something I'm definitely passionate about. I didn't have any health insurance really growing up, honestly. And so if it's something that we can, offer to people and not have to go through insurance and they can afford and make it accessible and make people sleep better and their lives better, like I think that really means the world to all of us who help with Allergy.
That's such an incredible tenet of your company, and I can tell that it drives you personally. It is a huge problem that I don't think
It
one
is.
person can solve, but each little person chipping away at our own field is going to help. So thank you again for that.
No, thank you. I learned a lot from you today too, so thank you.
And vice versa. I appreciate the conversation. Thank you so much for coming on Wellness Your Way.
Thank you.